Brigitte very kind of in the introduction spoke about me. The Seafarers Hospital Society is a very old and established maritime health charity. Our focus is always on seafarer health and well-being. And so we've been looking after really the health and welfare of seafarers for more than 200 years now. So we have a really good understanding of what it is that what it really affects seafarers' health and well-being. So this morning I'm going to play for you a very short video which kind of gives an introduction into the past, the work that we've done in the past and the work that we're doing currently. We very much have a preventative approach to seafarer health, and this video kind of really sets the context for talking about the importance of mental health in seafarers. Okay.
Yeah, no worries.
The Seafarers Hospital Society is a leading maritime charity dedicated to supporting the health and well-being of seafarers. All over the UK, on ships, in ports and in fishing harbours, struggling seafarers have turned to the Society for help.
It was in a very low place, and I didn't realise I was sort of so low, feeling pretty worthless sitting indoors all day on my own. So I just started drinking and everything else. I just went down and down.
Jerry isn't alone. There are many seafarers and fishers in the maritime industry facing great uncertainty. But the Seafarers Hospital Society are there to help and provide support, just as we have done for the past 200 years. Back in 1821, the Society was founded by a group of philanthropists. Its chairman was abolitionist William Wilberforce. The Society set out to assist the large number of homeless and impoverished seafarers struggling after the Napoleonic Wars. The dreadnought, anchored near Greenwich, was put to good use as a floating hospital to treat any of these sick merchant seafarers. The Society's work had begun, and over its rich 200-year history, it established itself as the only charity dedicated to caring for the health of seafarers across the whole of the UK. Always adapting to the changing times, the Society grew and grew, eventually running hospitals and dispensaries on 8 sites across England and treating tens of thousands of seafarers a year. It wasn't long before the Seafarers Hospital Society was recognised as a leader in the field of medical care and research. The charity has withstood recessions, depressions and 2 world wars, also survived through several pandemics, including cholera. Even today, with the worldwide effects of COVID, the Society is providing much-needed support to modern-day seafarers struggling with life's challenges. 25 years ago, the Society set up SAIL, the first and only free advice line just for seafarers, in partnership with the Greenwich Citizens Advice Bureau, providing information and support on a wide range of issues, including benefits, housing and debt. Over the last year, the Society has given out grants over £300,000 to seafarers facing financial hardship. The buildings and hospitals the Society once ran were absorbed into the National Health Service long ago, but the care hasn't faded away. In keeping with its founding principles, seafarers today can still get treatment through the Dreadnought Priority Medical Service, based at Guy's and St Thomas's Hospital in London, enabling them to return to work as quickly as possible. But care is also available for retired seafarers, who can get access to specialist dementia care, supporting family members as well with advice and support. Life at sea is not for the faint-hearted. Crew are often at the mercy of the weather and spend long periods away from their families, and finding time to visit the doctors or the dentist is a challenge. But the Society is helping with this. Working in a joint initiative with Seafit, a range of healthcare services are available direct to the fishing community at the quayside all over the UK and free of charge. partnering with Smile Together, one of the Southwest's largest NHS dental care providers. The Seafarers Hospital Society has set up free dental checkups for the fishing communities. Mobile dental units are delivering dental treatment in harbours, right alongside the fishing boats. Also, the prevention of dental ill health is being targeted at primary and nursery children through an oral health programme, Brighter Smiles. This educates the children how to look after their teeth and prevent more serious problems from developing in the future. The Society has built up a wealth of expertise about the impact of fishing on physical health, and so encourages seafarers to have general health checkups to prevent illness which can impact their livelihoods. Seafarers can also visit selected physiotherapy clinics for free treatment when injured due to the physical challenges of working at sea. Evidence from the CFIT programme shows that fishers are more likely to seek help and improve their health when services are available just steps from where they land their fish, without any referrals or barriers. This makes a huge difference, leading to healthier lifestyles for them and their families. Less visible, but equally important as physical health, is mental health and well-being. The Society has partnered Together All to provide a safe and anonymous mental health support service. Seafarers and their families can easily get online support 24/7. This digital service gives access to trained counsellors, online courses, a support network, and one-to-one therapy sessions. When the emotional and physical stresses of life as a seafarer are just too much, help is just a click away.
Everyone, especially fishermen, everyone thinks that they can deal with every problem all on their own. And 9 times out of 10 you can't. But the nice thing was, the counsellor was at the other end of the telephone when I needed him. And through the counselling and everything, I'm now in a much better place. Still glad to be here now.
The Society is celebrating 200 years looking after the health and welfare needs of seafarers and their families. This help is needed.
Okay, right. Okay, so thank you very much. Thank you for your help. I think the poor man thinks I'm going to keep him captive here, so thank you so very much for your assistance this morning. Okay, thank you. So the video really sets the scene for us when we're talking about seafarer health, and Jerry was very kind to actually talk about his story. Jerry got to a point where he actually attempted suicide, and thankfully it wasn't successful, or he didn't complete suicide, and so he was happy to share his story. And actually, as he says in that video, and I find it really emotional because I've spoken to Jerry a few times, is that he says he's actually really happy to be around and he enjoys life, and things that he took for granted, he doesn't take for granted anymore. So to be able to provide a service that actually saves people's lives is huge. And in one of our kind of stats, or when they ask us about the greatest achievement of a program, the greatest achievement for us is when one person says, I'm still here because of the service you provided. And so today really I'd like to talk about On Course for a Culture of Care, and I'm just going to talk about how it is we kind of came up with the concept of a culture of care, and I'll talk about that a little bit later in the discussions. So the background to this is that we were trying to find out the impact that research has on seafarers, on their physical health and their mental health. And in recent years, I've seen a huge amount of data and surveys and research being done. And actually, one of the questions I had is, what is actually being done with this data? Is this data taken, and the recommendations from all this research, is it actually making a positive impact on seafarers' lives? And what difference is it making? So we see reports that come out with recommendations, and then what happens to all of those recommendations? What is the positive impact on seafarers' mental and physical health? Because for me, these two are inextricably linked, okay? You can't separate one from the other. If people have poor mental health, it has an impact on their physical health and their ability to actually function on day by day or day to day in their work. So the report from our landmark study, which we conducted with Yale University, it was kind of research to date and current practice, looked at, I think, about 3,000 papers or 3,000 pieces of research, and looked at some of the common issues that they were facing. And so they found common health issues and well-being issues relating to people's physical health. And I'm sure when you look at some of these, this is nothing new to you. You would have seen this in the course of your work in terms of their psychological issues that they were facing and personal lifestyle issues. But all of these will impact their physical and their mental health. So let's talk a little bit about mental health and well-being then. What is mental health? I think it's important for us to realize that we all have physical health and we all have mental health. So good mental health is crucial to how well crew are motivated and able to perform in their role. Crew with good mental health tend to be more productive, achieve better results, and have fewer accidents. And the signs of mental illness can be observed in seafarer behaviour and performance. And actually, we heard about that in that opening introduction, where symptoms can manifest themselves in the inability to cope with reasonable work demands, missing deadlines, failing to complete tasks, and changeable behaviour. People even displaying kind of sudden outbursts or short attention spans. So the ITF Seafarers Trust did some research into seafarer mental health, I think about 5 years ago now, and the research found some very interesting things. So 28% of the group that they screened positive for anxiety or depression. Seafarers who screened positive for anxiety and depression were twice as likely to suffer an injury at work in the previous year, and this is also true of illness. And 35% of those with depression asked nobody for help. And that for me is the most concerning thing, where people are not asking for help. And the reason for this is because there still is some stigma attached to mental health. Globally, mental health problems affect around 1 in 4 people during their lifetime and are estimated to affect 1 in 6 people at any given time. The problem is we don't have the absolute statistics on how many seafarers are affected, but I guess if it's 1 in 4, it must be 1 in 4 seafarers are affected, and certainly that report from the ITF Seafarers Trust actually points to that. But the stigma attached to having a mental health problem means that crew may be reluctant to get help or treatment, and it may actually, because they're concerned that it may impact their employability. The sad thing for me is that mental health or poor mental health or mental illness is just the same as a physical illness. If you can treat a physical illness, you can treat mental health illness. And so if people would talk about it and we remove these stigmas, then actually you would see fewer people struggling to kind of cope with their mental health. And sadly, the worst case scenario when people are struggling with poor mental health is that it may result in suicide. So some interesting facts for us this morning. It's twice as common in men as it is in women, and it is the second leading cause of death in the age group 15 to 34 worldwide. And so we know that seafarers fit into that group, if you like. And so let's look at some of those risk factors. So it's problems with access to health systems, discrimination, so we talked about the stigma that's attached to that, the available means to suicide. So it means that, if they're on board a ship by themselves, it's dark and the waters are there, then I suppose it's easier for them to kind of slip into those waters than it might be for somebody else. They may have suffered trauma or abuse, the stigma associated with actually seeking help, a real sense of isolation and lack of social support and the social networks that they may have when they're at home. So what is actually being done about mental health? So you saw in our video some of the things that we're doing, and we're using digital kind of means to enhance our care for seafarers. And the service model that we use through Together All is a peer-to-peer support through an online community, which is really great, courses and resources for self-management of people's poor mental health. And these are all monitored by 24/7 wall guides. And it's really important that we have these clinicians who monitor what people are doing, because they pick up on issues that people are facing. And actually, there have been 2 instances in the past year where actually they reached out to the individual and said, we think you need some help. The person wasn't willing to look for help, but they actually escalated it to an emergency and actually were able to trace their IP addresses and contact them. They actually sent emergency services around just to ensure that the people were actually safe. So it's very important that if you provide these services, you actually have the means to save people or to rescue people, if you like, should they be facing that worst case scenario. And so in the past year, I've looked at some of the statistics, and these are very interesting because I think they link to some of those stats that we saw from the ITF Seafarers Trust research. So we see that 67% of people who are struggling with mental health in the past year who've accessed our service actually identify as male, and 1 in 4 live alone. Reaching those, we're kind of looking at 71% have no formal or mental health support, and 1 in 3 have no support from family as well. So it's again where they're not talking to people about the fact that they need help. This concerns me as well, where 1 in 5 people have considered suicide in the last 6 months before registering for this, and 13% have actually considered self-harm. And then we've had 36% kind of interventions from clinicians at Together All, where they felt that people needed more intensive care and help and support. This is also quite an interesting stat, where 60% of usage is out of hours, and the most common category tags are anxiety, depression, stress, loneliness, and problems with relationships, all of which kind of points to what that research was in fact saying. So we have this research, we have all the statistics, and so we believe as part of our ongoing work to improve crew health and well-being, that we put in place what we call a culture of care, which really is a robust framework for data collection about seafarer health and well-being that companies can actually put into place. And our paper outlines kind of industry stakeholders with minimally disruptive, cost-effective, and viable measures to implement a culture of care within shipping. And what we've done is we've put together KPIs which we believe can make a real difference to seafarer health and well-being and the effectiveness of health programs over time. So we've put together, as I said, these KPIs, and we've put them around the following factors. So firstly, fully meeting international requirements for securing seafarer health and maritime safety. Secondly, to actively support health and promotion activities for seafarers. And then ensuring that conditions for seafarers minimize psychological distress and ill health. And so we've put these together, and hopefully I'm not going to read through absolutely every single point, but these are the kind of key performance indicators that we're looking at. So frequency and nature of injuries on board leading to loss of life. Okay, so companies will be looking to either reduce that frequency or to look at those and then do something to actually reduce those, or to understand what is actually causing these things. So frequency of contact with maritime telemedical assistance services and outcomes. So frequency of medical evacuations and deaths on board, frequency of referrals for medical or dental advice in port. I guess there's nothing you can do about that if people get ill, but also frequency of repatriations for medical reasons, frequency of termination of employment for medical reasons as well. And then health promotion activities. So I think this is where companies can make a real difference in terms of creating that culture of care, where we can see measurable inputs such as increased healthy food options, exercise facilities, and educational facilities. So it's not only about the mental health, but it's about the physical health as well, because as I said, both of those are closely linked. To look at measured uptake of health and wellbeing programs, assessing the numbers and proportions of people who are participating in those, as well as a provision of support while ashore through seafarer access to performance data and personalised advice. Measurable advice and outcomes about your BMI, so healthy, making sure people have healthy exercise and eat healthy diets as well. And again, improved reporting on communicable diseases without any stigma attached to those. So that's very important. And this is something that really needs to come from the top down into each company, because people need to see the difference that it's actually making. And so each manager needs to be really invested in this and understand why it is important. And just some more health promotion activities, really, the implementation of preventative measures such as vaccination of all crew, and that's become something that's even more highlighted after COVID, the importance of ensuring that people have the right vaccinations, the right medical care. The institution of regular awareness and raising campaigns. So awareness raising campaigns. So on things like we find, people aren't having regular health checks, so regular cancer checks, just to ensure that we have this preventative program going ahead. So I think it's incumbent on companies as well to actually help with those preventative messages and help to raise awareness as well. And then education about risks, such as awareness campaigns for cancers and things like that as well. And actually there's a whole range of resources out there. So we put a load of stuff out, ISWAN does. The Maritime Health Advisors put that out, and I know that the P&I clubs do a really good job of sending out really helpful resources to companies as well. Then in terms of psychological well-being, we think that these are really important KPIs, and so we're about ensuring that benchmarks can be inputted on the basis of current provisions for each of these aspects, with records of steps taken to actually improve quality, to take confidential surveys of crew views on quality of life at sea and exit interviews with seafarers who are leaving, to look at kind of potential shortcomings within organisations as well. It's really important to monitor complaints and conditions about shortcomings on board ships as well. It's really important. And then putting in a very simple thing like an employee assistance program can make all the difference, having that confidential line outside where people can actually talk about the things that they are having difficulty with. This is doing a thing again. Okay. So we realize that these KPIs can be quite complicated and complex. So what we've done is we've developed a self-assessment tool, which kind of can be used by the maritime industry. It has 4 levels, and this is as I said, it's a self-assessment tool, so nobody's going to be monitoring what they do. And I think for a lot of people, they're frightened to kind of give information, but this is something that they can do and have access to, and kind of look at the analytics of what is actually working in their companies and what actually isn't working in their companies. And we've kind of put in these 4 levels, and the first is our base level, which looks at kind of audited compliance with the following MLC regulations, and these give essential inputs specific to seafarer health. So we're speaking about those things like frequency of referrals and various things like that. And the performance indicators look at kind of management systems in place to meet each of those aspects, an audit of management systems to ensure each input for seafarer health is actually met, and assessment and documentation of health and safety risks on board, and define procedures for risk management and monitoring. So they can actually either tick all of those boxes, or in addition to that, actually put in supporting information to show that they are actually meeting their own requirements as well. And the next level would be a performance accountability level, which again looks at audited and available data collected on measurable processes, outputs and outcomes from base level compliance. And these findings will be shared with seafarer representatives, either within the company or even some of their trade unions. So again, where they hold themselves accountable but actually show the progress that they're making with important bodies for seafarers. And the kind of performance indicators that we'll be looking at is the kind of number and nature of illnesses on board, the communicable diseases, I can't say that word this morning, and active preventative measures that are put in place, the number and nature of health-related injuries and suspected occupational ill health, and just kind of that whole list going through those things. I don't want to read them all and bore you, but those are the kind of things really that companies should be doing at this next level. Then we would have an enhanced level, and this really is about identification of health-related consequences of other MLC regulations and codes, with steps taken to enhance beneficial aspects and minimise harmful ones. And this really would mean that management and officers can actually look at the relevance of active health management, and again, something that needs to be coming from the top down and seen throughout the whole of the company. And the performance indicators that we'd be looking at would be audited compliance with health-related aspects of listed MLC regulations and codes, measurable uptake of promotional activities, again, things that I believe can make a huge impact with very little financial input from companies. Outputs from programs to reduce risks of common forms of long-term ill health, such as arterial disease, musculoskeletal pain, and cancer, all of which will have a real impact on seafarers' mental health and well-being as well. Stigma-free analysis of crew psychological well-being from confidential surveys, concerns, complaints, and changes to work performance. The provision of EAPs, which I was talking about, and access to and use of maritime health expertise for the benefit of crew as well. And then the best practice level, really actively you see the kind of corporate policies to safeguard and promote health that are implemented company-wide. And again, it has to come from the top all the way down. And these things are only effective if it actually, your managers are the first people who they train and make sure are able to communicate that message really effectively to their staff. And so I believe that once we put all these kind of KPIs in place, and once we're able to convince the industry and the sector as a whole that this is a really important thing to do and will make a huge impact, positive impact to seafarers, we believe we will see the kind of a workforce that is far more sustainable. But I believe this kind of comes one step at a time. So if you're interested in these or would like to help us to promote these across the sector, please let me know. You can kind of go onto our website to register what your interest would be, and you can talk about, attending a webinar, complete a short survey, or even participate in roundtable discussions to ensure that actually the KPIs that we're putting in place to create a culture of care are actually viable and will make a difference.